If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. Welcome to another episode of Talking with Dr. Donna. Thank you so much for keeping your appointment. You know, you have an appointment every Thursday at 6:30 p.m. with the doctor. Tonight, it's going to be awesome. We are going to hear from the educators. We've been talking a lot about schools. Should schools close? Why aren't schools closing? Should kids go to remote learning? Should they not go to remote learning? All of those questions. So tonight, we're going to speak with the educators to have them answer those questions. As a reminder, if you are not already a total friend of Talking with Dr. Donna and you haven't subscribed, please do go over to my YouTube channel if you're watching on Facebook, or even if you're watching on YouTube, take a moment, pause, subscribe, and then hit that bell icon right next to it so that every time I go live, you will be notified. Remember, there's many ways to connect with me and to stay in contact through the week. We do recipes and we talk about how we're eating our food of the month and just general knowledge about health. During the week, this is how you can reach me. Facebook, Instagram, at Talking with Dr. Donna. Just let us know how we can stay connected. So do let me know. As you know, our goal here on Talking with Dr. Donna is to build a network of generational health. That's my phrase, that's my term, generational health. We are going to end the cycle of premature death in the Black community. I promise you, if we pay attention to these four pillars, our spiritual pillar, our spiritual health, our emotional and mental health, our physical health, and our environmental health, together with all four of those pillars, we pay attention to each of those pillars, we are going to dramatically impact our health. And when our health is better, the next generation's health will be better, the next generation's health will be better, and we will end the cycle of premature death in our community. So thank you so much. Hi out there. As you know, we're live. So anytime you have a question, you can put that in the comment section and I'll try to get to your questions during the episode. So don't be shy. Go ahead, get out there, get your questions out there so we can ask the educators that we have on tonight. So again, tonight we are talking about COVID in schools. So I have three excellent guests tonight that we're going to have a conversation about schools. And so let's bring them on, shall we? So let's first bring in LaTora Baldridge. Hi, LaTora.
Hi, Dr.
There you are.
Hi, and good evening.
LaTora is the principal of Lodestar Middle and High School.
Yes.
So thank you for being here with us. All right, next we're going to have Dion Embry. Good evening, Miss Embry.
Good evening, everyone. Thank you for having me.
Thank you for being here. Miss Embry is an English teacher at Castlemont High School. So thank you again for being here. And last but not least, we're bringing on Jeff Taylor. Hello, Mr. Taylor.
Good evening, Dr. Donna.
Good evening. So Mr. Taylor is the principal of McClymonds High School. So thank you all for being on Talking with Dr. Donna. All right, let's start. So many different people, we've had lots of conversations about remote learning and safety in our schools, particularly around COVID. As I've tried to share with folks, it's really a much more complicated decision than just simply saying yes, let's just shut down schools because it's the safest thing to do, or no, we're not going to shut down schools because that's not the safest thing to do. So, Mr. Taylor, can you walk us through the process and how is the decision made, whether or not, what do you take into account when you're thinking about whether or not for your school to be on remote learning or to stay open?
So, fortunately for me, I don't have to make that decision. That decision is made above my pay grade. So it's more so state and the federal government. It has a lot to do with our funding and attendance. So that decision is not made by us as to whether or not we're going to shut down. Um,
Okay.
so yes,
So that decision, is it made at more of the district level with the county or the state level?
state and the federal government.
Okay, so there you go. I hope you guys are hearing this. The state level, the federal government says when you can go remote or not. Mrs. Baldridge, is that safe for you?
So I'm the principal of a charter school in Oakland. So we have a little bit more autonomy in some of the decisions that we can make. But just like Mr. Taylor said, it's not up to us if we can close. It's really if we can go into what's called distance learning. That is something that's decided by the state. And right now, the state has decided that no school should be in distance learning. What we've done at my school, because we coming back from Christmas break, we had 1 in 5 students who either were exposed to COVID or who tested positive. We were able to send home every one of our students with the at-home testing kit. And when we came back on Monday and Tuesday, there were so many children who were testing positive and who had to be sent home. And then so many of our adults who then tested positive and had to be sent home. So we got to a point where we didn't even have enough staff members to run our school safely. We didn't have enough people to fill our classrooms. And then we had a good amount of our kids who had no access to their learning at all. As we continue to test, and more kids reported exposures, their moms or their grandmothers or, their dads were sick, siblings were sick, and then they started to test positive. We decided to go into what many people call distance learning. The difference is that every single student is now on independent studies. So even though they have access to their teachers online, what we have to do as administrators in order to recover our attendance, in order for the state to continue to pay us to manage our school, we have to submit paperwork for every single student to be on independent studies. And that's a monumentous task. I mean, it took just for my school, which is a little over 400 kids, it took 5 adults, and we started at 7 this morning, and we just finished at 6:15, and I'm still not done.
Wow.
And we had to do that in order to, one, provide an opportunity for our kids to still have access to education in a safe way while they're sick. Many of our students who logged into Zoom today have COVID. My family included. I have 2 kids who go to my school and they were sick. My husband got sick after that, and then today I'm feeling symptomatic.
Oh, wow.
So it has been so crazy, and I'm grateful that I'm at where we can make those sort of decisions, and we are small enough to be able to do the paperwork and backtracking. And I wish that we didn't have to be put in that kind of position to do all of that work just so that we can safely teach our kids.
Wow. Thank you. Thank you. That is so disheartening to hear that the state while you're attempting to be safe, right, to keep your students safe, the state is saying, well, we're not going to pay you because your students are not on campus unless you submit all of this extra paperwork.
Yeah. And
Wow.
Dr. Donna, I see someone in the chat is saying, well, what happened in Hayward then? They closed for 2 weeks, and some private schools have closed for 2 weeks. Hayward is at a risk of losing millions of dollars, because for every day that a student doesn't attend school, the school doesn't get paid. They don't get reimbursed. And school is also a business, and it costs a lot of money to run a school. So Hayward made the decision with the hope that the state would support that, but we don't know at this point.
Wow. That is a lot. And thank you for reading the chat. Lots of people are putting comments in, and we'll definitely make sure we get to all of the questions that are in the chat. So keep sending your questions in. But I want to have a question for you, Miss Embry. So, when you go into distance learning, that's challenging for both teachers and for students. So as a teacher, which is more challenging, being in school and having kids missing and knowing that they're not learning, or trying to juggle what you need to juggle to do distance learning?
I really don't feel like there's a comparison with the recent increase, and it's so unfortunate. There's been a recent increase in the cases. I think that's really the main point and focus,
Yes.
and why things are the way they are. Students do need to be in school to get that, social piece. They like to see the teachers, but a lot of students are scared. A lot of students are catching COVID. On Monday at our site, there were 11 teachers out. Today, I thankfully tested negative because I had thought I was developing symptoms, and so I quarantined myself. But I think that we could possibly find a balance. I think it's a matter of the district actually working with the teachers union, community, parents to make decisions, as opposed to the decisions coming from the top down. Students at various sites voted to do a sick out today because many of them are concerned as well. I think it may be able to work with doing in-person and distant learning like we did when we returned from distant learning in the past year. Both are very, very hard and challenging for students. I just feel like if we all work together and it's not just a decision that's coming from the top down, that we might be able to be strategic in coming up with a plan that could have a balance. Parents need to be empowered. Parents need support, especially in schools like mine in Deep East Oakland. Parents need to be empowered. We need to reinvite parents into the schools. You've heard about other schools, districts having parents volunteer. And I just feel like that's the piece that we really need to make stronger, is the parent involvement, especially in the inner city schools and the more low income areas.
Yeah. And so one of the other challenges that we've talked about and heard about with doing distance learning is the ability to actually have a computer, to be able to log in to classes, having the internet capability to be able to log in, or multiple people in the household trying to use one computer. Talk to us a little bit about those challenges and what you've been seeing with that. I'll start back with Mr. Taylor. What challenges are you seeing, or did you see when you were in remote learning or distance learning with McClimate students?
So one thing that we had to do, we did a lot of drop-offs. So we actually took a lot of computers homes, but a lot of our students came in to check out a computer, and through the generosity of Intel, I believe, the Square Corporation, all our students was able to qualify for a device that they got a chance to keep. Also,
Nice.
Wi-Fi. For those who didn't have Wi-Fi, they got hotspots.
Nice.
And one thing that we did, we called everybody, all our students. I sent out, robocalls. I did text messages to all our families. So they came in and either checked out or borrowed or got one that was given to them that they get to keep. So all our kids had access to technology, which was
That's
great.
great. That's amazing. That's amazing. Thank you. Shout out to all of the organizations that made that happen. That's
Most definitely.
amazing. Yes. Mrs. Baldred, what are you seeing in your school with now that you're back to distance learning? Any technology challenges?
Yeah, I would say like when we first went into distance learning in 2020, tech was a huge barrier. It was like kids didn't really know how to use the computer. They weren't that computer savvy. Same with teachers. It was a learning curve that we had to overcome, as well as like the physical barrier of not having a one-to-one device. I would say we learned from that. And this year, every single student has a one-to-one device, even when we are in
Wow.
person. So it made it easy to transition back to distance learning this past week. But there's still issues like, sometimes the Wi-Fi cuts out, or
Right.
for teachers, the teacher's Wi-Fi cuts out,
Right.
or their pause. I think more than the need for technology, it's something about the distance. Like kids
Hmm.
cannot fully connect with their teacher, and the teacher can't fully connect with them, and it just makes it much more difficult. Like me personally, my son who is 5 goes to my same school and is on distance learning. And the first day, he was really excited. It was cute. He's like talking to his friends on the camera and like everyone's having fun. And now, fast forward, we're like in day 5, and he's over it. He doesn't
Mm.
understand. He's having a hard time paying attention. He needs me to re-explain what the teacher is explaining on Zoom. So the distance that is happening is something that we can't buy. There aren't
Right.
more tools to make it better. So that's what makes distance learning really difficult and unsustainable, even when we have to do it.
Great, thank you. And Miss Embry, what are you seeing with your old students and the connection that you're able to make in teaching?
I agree with both the panelists. In terms of it is much better now. I'm very proud of our site. We have over 90% of students who have one device at home.
That's great.
When distance learning happened, we ended up having to just give out all of our Chromebooks. We were able to order new Chromebook carts for on site, and every student has a Chromebook now. That is one thing I will say that Oakland Unified has done very well with. There's an OTX center that parents can go to for support. If a student needs a hotspot, they can get it. They got a hotspot that lasts unlimited for 2 years through Sprint. Like the principal from McClyman said, there were tons of donations. And so, that's great. Again, I feel like it's the parent piece in connecting the community in
Mm.
terms of helping them to gain the skills to know how to manage the computer platforms. I have advocated our site for parents learning how to manage Google Classroom, how to manage, in the internet. Um, just in case we have to go back home. I feel her that the distance is a big deal and students really want to be at school with each other. But
Mm-hmm.
it's unfortunately with the surge, that it's not necessarily as safe. And it's just, it's overwhelming for schools when you don't even have the teachers to teach. So I
Right.
feel like that's one thing that OUSD has done a great job with. The person at our site, make sure the kids take their free survey, paper surveys if you need it, Spanish surveys if you need it. Come
Yeah.
on up, we'll drop it off. I just feel like maybe parents aren't necessarily empowered with how to master distant learning in their homes. A lot of homes
Mm-hmm.
have a lot of family members. They don't have the space for the students. So I think supporting parents with that piece, if we have to go to distant learning, is what's going to help make it a little bit more, successful. But again, I feel like in-person learning is probably best for the students.
Yeah, you hit that nail on the head. As a parent who has 2 kids at home, when we went to distance learning, we had to figure out, well, where are people going to work? Like I had to work distance, my husband had to work distance, and then the 2 kids. So somebody had the dining room, somebody has to be in their bedroom, and we have different places. But we have the luxury of having a large enough house to be able to do that. And not everybody has that luxury. And so it's difficult to not just the technology piece, but finding the space. And as parents, how do we support our kids in distance learning, right? Because we have to sometimes be the teacher, and because they're not connecting with their teacher, they're not getting the lesson, then you're attempting to teach them the lesson, try to keep them engaged, check in on their homework. It's a lot for parents. So what suggestions do you have for parents whose kids they may have chosen to do distance learning, or they may be, forced to do distance learning because that's the decision that the school made? What suggestions do you have for parents? Help.
Learn Google Classroom.
Well, I would definitely say that is definitely a must. Is for parents to understand what Google Classroom is, the platform. One thing that we did through our after school providers, our extended day program, we did every Tuesday we had parent Zoom ins, so the parents could Zoom in and learn how to navigate through the platform, how to log on to the parent portal, so they can see their students' attendance. They can track the grades, and they can see, what work their students have been assigned. They also can see how to, connect with their teachers. So we did that every Tuesday for our parents.
That's great. I should have zoomed in on yours. Why didn't you invite me, Mr. Taylor?
Right, I'm going to take that idea. I think it's an accountability piece too, or it can be for parents, teachers. I know it's a hard job, but we, are accountable to parents. And so the more parents are familiar with online platforms, the internet, emails, the better the communication can be, and to hold teachers accountable for, being there for them, and especially at this time of need, because we are the experts, we were trained in this field.
Yeah, I would say from both my principal lens and my parent lens, having 5 kids in the same house doing distance learning for the year, I would say set a schedule. Like, the kids need a schedule. They have their schedule on Zoom, but what do they do on their breaks, right? How do they schedule their time when they have to do independent work? Those are things that, like, if you know their schedule and they know their schedule, it helps kids keep that motivation to keep working. Because we know at the beginning of this distance learning, we had kids who were really engaged, who logged in, who were doing work. And the longer it goes on, the more kids started to drop off. So that's something that we really need parents to partner with us in. And I know the school calls a lot, but you got to answer the calls. I know it's a lot, and I understand, because you're also balancing work and other responsibilities of your home.
Right.
But that's our only tool when we're at distance. You are our only tool, so we do need our parents to support us, and your kids need that schedule.
Yeah. What are
Also,
your kids?
I think one
Oh,
challenge that
go
we
ahead.
didn't anticipate going into distance learning is not only is that student inviting the teacher and their classmates into their home, but vice versa, the teacher is also inviting students into their personal space. So that was like a challenge. Some of our kids don't live in the most ideal situations. So, you had a lot of students sitting in class with their cameras off.
Yeah.
Teacher, complained about that, all everywhere. But, you had to be mindful that, that family was inviting you into their personal space, which is not, something that everyone may be welcome to. I mean, there were many situations where, parents forgot that the kids was on the camera and, walked in, not properly clothed or whatever. So,
Yeah.
that was definitely a challenge.
Yeah,
I think what the
I can understand.
What Lodestore's principal said was right in terms of a schedule, because I felt bad where it's like, I have to cook breakfast right now, or I'm watching the kids right now, and I get it. Families are dependent on each other, especially for parents. Like someone said in the chat, like they don't, they can't work at home, work from home. They had to go off to work. But if you can, try to set a schedule so that the students can focus on school. Again, full service community, like we have to work together as a community, teachers and parents,
Yes.
in this, in a pandemic like this, with this kind of situation, we have to come together. Otherwise, I just feel like it's not going to be the best for our babies.
Yeah. So there are a few questions in the chat. Number one, let's see, you kind of touched on this a little bit already, but how do you encourage parents to understand their child's progress while you are in distance or remote learning? How can the parent connect with the teacher and find out how their child is doing?
I think the same way, actually, while we're in person learning. Platforms. Unfortunately, like we have Parent Square and Talking Points, for example. I have 100 and so kids on a roster. You can see who actually reacts, and it's very few. I've thought about maybe having classes on teaching how to use the platform, teaching how to communicate. But even Google Classroom has an area where parents can comment to teachers, email. So a lot of the ways that you can communicate are the same that are in person. It's a struggle in person, at least at my side as well,
Yeah.
in terms of parent communication. But that hasn't changed much at all. And many teachers are open for after hour Zooms. My husband works at a charter school. He's been on Zooms at 7 in the evening. Many teachers, share their cell phones or have a Google Voice or phone number, so that their own phones aren't inundated with the communication. So I feel like the platforms are pretty much the same. It's just that we really, really encourage parents to use them more and learn them. I tell the kids, make sure your mama download Parent Square.
Yes, got it. So for the parents to reach out more in a different way, but they can still reach out. All right.
Like really, really know the learning management platform. And almost every school will have a way for parents to readily access their students' work, right? But you just have to know what that is. And I would say also know who your contact person is. If your school has an advisory model, right? Do you know your student's advisor? That's the one you're really going to go through to answer questions, to get those off-hour Zoom meetings. So make sure that you know who you can contact and have their contact information. I would say something that teachers and educators have really learned from distance learning is that they often provide resource materials readily for parents. So it might be a video of the lesson that's uploaded if your child had to miss a day, or maybe like different sets of instructions. So just make sure that if someone isn't contacting you or you feel like there's a distance, know who you're going to call.
Great. Mr. Taylor, did you want to answer that question as well?
So we have in Oakland Unified, we have a parent portal. So the parent portal, the parents can log on in real time. They can see whether or not their student is in class. Again, they can see the assignments assigned to them. They can see the grades from the previous assignments. They can also email directly the teacher from that portal. So it's a way for them to be in communication with the teacher and not have to wait until a report card or a progress report comes out. So they can see, daily what their student is done. They can see whether or not they're engaged in class. So that's definitely beneficial for our families. And then it's important that they understand that this whole education process is a team effort. It's not just the teacher, it's not just the student. It's a three-way process. It's the school, the student, and the parent. So it's a team effort.
Great. All right. Thank
On the
you.
district level, I think the districts need to realize just the reality of inequities. In some neighborhoods, some schools, don't get as many resources and get as much support as others. And so, especially during a pandemic, I think it's important for, the powers that be, the folks at the districts, to consider that and to maybe provide extra support and create strategic plans to get into the community, whether it be doing home visits, doing a mega bus, getting into the, community-based organizations and the churches, just to try their best to support the parents beyond just having the principals at the site take it on themselves. It's too much during a pandemic. Principals in those kind of schools already have so many issues that they're dealing with. So I think the district really needs to look at, those schools that aren't necessarily having equity in terms of resources and support.
So thank you for that. That leads into one of the questions that's in the chat about inequities in learning with Black and brown kids. Are you seeing the inequities during, let's see, do you mean distance learning, or and how decisions are made during this pandemic? Are you seeing any inequities for Black and brown students?
Most definitely. I know a lot of our families are not really, they're concerned about catching COVID. So, a lot are apprehensive, of sending their kids to school when they hear about an outbreak, or opting to do independent study. So they don't have, so they're not engaged in regular school because they're stepping away. So it's a challenge, because the Black and brown community is not there. There's a lesser vaccination rate than in other communities, unfortunately. And I hope that changes, because COVID is not going away.
Right. Do you know what the vaccination rate is at your school, Mr. Taylor?
We're about maybe 40%, and that's partially and fully vaccinated. District-wide, we're looking at about 62% fully vaccinated, 69% partially and fully vaccinated.
Wow. So that's not nearly enough to really, the part of this pandemic, the part of the reason why it's just sort of prolonged is the number of unvaccinated folks in the community. And so I'll ask this of each of you, do you know what some of the reasons are why people are still such low vaccination rates in the schools?
Man, that's a hard question to quantify, because we get all kinds of reasons. Sometimes, it's just that the fact that I've had kids who parents come and say, "Well, I don't know what that is," or "I don't know what's in it," or "I'm a little skeptical what it's going to do in the long run," or "I don't think I need it. I had COVID already." So there's just a lot of distrust and misinformation that's happening in the community, and I think it's happening more often in communities of color. And this is where, like, we are disproportionately impacted by the virus, because we have more people who have this level jobs where they're interacting with more people than others. Like, they don't have the privilege of working from home and quarantining and still earning enough income to care for their families. And they really depend on school. So when our families have to figure out what's going to happen with their little ones, because they still have to go to work, it just makes the impact of distance learning even stronger,
Right.
because it's multiplied with economics and
Right.
demands that parents have to face in order to continue to provide for their families. We're doing all we can to support our families in their willingness to kind of hear the science. Our science teachers are actively reaching out to a lot of our family members to kind of explain the science behind the vaccine. We have a vaccine clinic on our campus, as well as a free testing site, and that has helped some families who are first unwilling, but we also have adults. Like we have educators who are also
Mhm.
and that's interesting, like this is something that, because I feel personally, because of social media, because of the way that
Mhm.
any person can have a voice that then is
Right.
touted as truth, it makes it really hard to differentiate what is true and what is someone's opinion, and that's what
Right.
I'm dealing with.
Right.
Yeah, I agree. Misinformation, social media. There's students who don't
Mhm.
even believe there's a virus. But I think that as educators and people in the school, we have a duty to, really get that information out to students and parents. Don't be afraid, speak up. I tell the students they've all had vaccines in their bodies since they came to school. Um,
Mhm. Right.
and I know for us at our site, we're pushing January 31st. That's the date to get your vaccine. You don't get your vaccine, you're in person, I'm sorry, in distant learning. And so what I've done individually as a teacher is in my Google Classroom, I've done postings of the vaccine clinics that are near, especially in our
Mhm.
own community, Roots Clinic, Castle
Right.
Rock Clinic.
Right.
We've created slides for them to know how to upload their vaccine and email it. I've taught them how to put the vaccine in the iPhone,
Right.
just really
Yeah.
just empowering people and enabling them to have these tools and the skills to be able to access accurate information, appropriate information, and to be able to, just follow these protocols and guidelines that we're asking them to.
Yeah, so this January 31st is the mandate, right? And all children who are not vaccinated by that time, what happens?
They either go into independent study, or the parents do have the option. The ones who are adamant about not being vaccinated, they can opt out by going to a doctor. There's a form that they take to the doctor. The doctor is supposed to explain to them the benefits of being vaccinated. You know, the explain the vaccine itself, you know, just to make sure they're educated about the choice that they're making. And if the parents still are adamant that they're not being vaccinated, the doctor signs off on that form and they can turn that form in and be exempt from the vaccination and still be able to attend in-person learning.
So attending school at their own risk, in a sense. They
Pretty
get the
much.
information from the docs, and then if parents are still saying, I understand, but I still want my kid to go to school, then they can sign this waiver.
Correct.
And I
I
believe
think
that,
oh, sorry, go ahead.
no, sorry, just quickly, but distant learning is actually one of the exemptions, correct, sir?
Yes.
It's considered an exemption. Yeah.
Yeah, but
Okay.
see, my thing is like that is something that's gonna further exacerbate the inequalities between schools, right? Because if you have so many kids who are either on independent studies or they go into distance learning, they have very little access to their education, right? And we know distance learning doesn't work for the long term. We're talking about our generational health pillars, our kids' mental health, their physical health, being in the house, like all of those things are going to be impacted for generations. And
Right.
the schools themselves, who then are losing funding, right? Because kids are not showing up to school. So it is, while we need our kids and our families to be fully vaccinated, I don't think forcing them out of schools is exactly the right decision, because
Mm.
the impact of that on our communities of color, on our small schools, our schools in Oakland who are being hit hard, right? We know who this is going to impact it, and it's not going to be our most affluent neighborhoods. It's not going to bother them. It's going to
Right.
bother us in Deep East Oakland. This is where the impact is going to be felt. So I want us to carefully consider that and balance how we approach the mandate for vaccines.
Yeah, I agree with you. I've always said that it is We are balancing public health, right? Because we want to protect our kids. One of the things that I have been saying about COVID and why it's so important that we don't want our children to get coronavirus is because we don't know the long-term impacts of having that virus in our bodies. And so we have to balance, we think about that, right? Generational health, right? We don't want our 5-year-olds, 10-year-olds, 15-year-olds to have a virus that remains in their bodies for and doing who knows what for 20, 30 years, right? There's that piece. But then there's also the piece of if you mandate this vaccine and people decide not to get it, then there's the impact of kids not being engaged in school. And of course, the folks who are deciding not to get the vaccine in the highest numbers are the same folks that already have inequities in terms of health and education. So it's like it's a double-edged sword. And which way is the right way? I don't know. Which one should win out? Should health win out or education win out? It's really a complicated decision, and I'm glad I don't have to make it because I don't know which way I would make that decision. So there's a lot of questions in the chat. We're going to have you guys back because there's so many questions, and this is such a great topic. But I promised you all I wouldn't keep you here all night. I thank you for being here. So I just wanted to say I have a ton of videos on the vaccines, why we want to have a vaccine, what's in the vaccine, what's not in the vaccine, myths. So you can always check out my channel. You're welcome to share my videos with your students and your staff if that helps in any way. But I want to give you all a final thought and question. Let's do something. Let's brag a little bit on each of your schools. So I'm going to let you go around and say something that's been great about your school, even in the midst during this time of the pandemic. What are you proud of that your school has accomplished? And we'll start with you, Principal Taylor.
Well, that's easy for me. During this time of COVID, we always want to look for bright spots. And one bright spot at McClymonds is the fact that we've won our 4th state championship in football, four out of 5 years. So I'm definitely proud of our football coach, Coach Peters, and his team. Our school for supporting them, the cheerleaders who are out there doing their thing, the alumni. So we definitely have an awesome family community at McClymonds High School, and I'm definitely excited to be there and be at the helm.
Awesome. Congratulations.
Thank you.
To McClymonds. That's amazing. All right. Principal Baldridge.
Well, I can brag on Lodestar all day long. Because it is my second family. And I say that because we are small and mighty together. Because of our size, we get to know each and every one of our students and their families. We really partner with our families to provide the best education possible and also to support our neighborhood of Sabrani Park. We've done a lot of neighborhood cleanups, and our kids lead the charge, just supporting and cleaning up their own neighborhood and being of service. And our core values of community, love, integrity, social justice, and agency just really makes our school a special place. And if you are looking, you need a high school, let me know. We got some room for you. So just you want a small, good school with a really funny principal.
So last but not least is Castlemont.
Yes, come on, Castlemont.
We are in deep East Oakland, on MacArthur in the Hood. We are a full community school. We provide services and resources for our students. We've been able to provide mental health services to many of the students. We serve families during Thanksgiving with food. We have vaccine sites on campus, and our pathways for our students have been very strong. We have, I'm the lead of the Community Health Education Academy, where we're working on initiatives to try to improve health in our community and to stop the inequities. And we have an urban design pathway who's done very, very great work with the Liberation Park and different affordable housing communities in the area, and continue with those trips and those field trips and visits and that work, even though COVID's going on. So we definitely invite you all to come visit, and please come check out Castlemont as your child's future school as well.
I love it. I love it. Thank you. You guys represent your schools well. Thank you so much again for being on Talking with Dr. Donna. You're welcome to hang out while I do a bit of COVID updates and talk about some announcements and our food of the month. But if you need to go, understood. Thank you so much again for being on this episode of Talking with Dr. Donna. I will be ringing your phones again to come back and finish this conversation.
Thank you for inviting me.
Much.
Thank you, Dr.
All right. So let's just quickly do our thank you. I know if you're out there, give some hand claps to our panelists. That was great. And so many questions. I know I didn't get to all the questions in the chat. And I will definitely bring them back, and we'll have a conversation a little bit differently, and not just about the remote learning, but a lot of questions in the chat about mental and behavioral health of our children during this time. So we'll bring them back. But let's move on and let's talk about, there's only one thing that I really am going to focus in on this week that I need you to know, and that is like the new quarantine guidelines. So complicated. But I want you to go to this site and look at it yourself and read it, because if you test, the quarantine is going to be different than if you tested positive, if you were exposed and vaccinated, or exposed and unvaccinated, what you need to do, different things for each one. And it's important that you recognize what your status is. And I'm going to encourage you to think of yourself as being unvaccinated if your shot was more than 6 months ago. And if you had Johnson & Johnson, if it's been more than 2 months, your vaccine levels and antibody levels in your body is probably so low that you're close to almost being unvaccinated. I know the CDC didn't say that. Public Health Department didn't say that, but Dr. Donna is saying that because I want you to go get your booster shot. And I want you to build back up those antibodies. We talked about this a few episodes ago about why it's important to get a booster shot, why it's important to make sure that your antibodies are at its peak, especially during this time with this highly transmissible variant. Omicron likes to jump from person to person super easily. Full families getting infected. So it is important that you get your booster shot if it's been more than 6 months. All right, so let's talk about where we are with COVID. Again, Omicron is causing cases to be sky high. And we want to make sure that you understand that the way in which you try to maintain yourself as being safe is to go back to where we were at the very beginning of this pandemic, when we said, wear a mask. I'm encouraging you to double mask. We talked about masking last week. Go back to that episode if you missed it and look at how and ways to mask. Social distancing, staying apart from people, not going into large gatherings, going back to that bubble. Remember when we were talking about having a bubble where there were just a few people that you socialized with? We need to go back to that. And then, of course, good hand washing, good hand hygiene, not touching your eyes, not touching your face or your mouth, so that whatever's on your hand gets into your body. So going back to the beginning, we got to go back. All right, food of the month. You know, Talking with Dr. Donna, we are really encouraging people to think about your diets this year. What are you eating? What are you putting in your bodies? So we've had food of the month. We had kale. We had squash. Then we had cranberries. Now we are on apples. And this seems to be the hit. Everybody is loving this conversation we're having about apples. If you haven't checked on my page and seen the sweetness chart of these apples from very tart to sweet, so many different apples, whatever your palate likes, you can get. And there's so many benefits to eating your apples: antioxidants, fiber, really helping to crave those afternoon, cravings of something sweet. And you want to put, I love Snicker bars. That's always what I talk about. Put that Snicker bar in your mouth. No, don't put that Snicker bar in your mouth. Instead, grab an apple, because it has so many different health benefits that you can benefit from. So let's take advantage of our food of the month and think about how to incorporate apples into your diet. I had a Granny Smith apple, which I hate because they're super tart, but I added some Gouda cheese and I wrapped the Gouda cheese around the slice of the apple. Woo! Man, that was good. So now, now I'm like, oh, I can try other apples that are a little bit more tart if I wrap them with some cheese or dip it in some peanut butter or chop it up into my salad and add a little bit of salad dressing to enable you to try different types of apples and have a variety for your palate. So that's our food of the month. If you try it and you have a great recipe or a great idea on how to use and eat apples, post it. Let us know what you're doing so that we can all have a great idea of what to do with our apples this month. Those are my handles. That's how you can post. Let us know. Let's keep the conversation going. And then briefly, some announcements. Tomorrow, if you have nothing to do at noon, join in to De Anza College. I am presenting on generational Black health and wellness in honor of Dr. Martin Luther King Jr. So join me. It's free. You can register. Join me and the other Black faculty and staff and administrator network doing a Martin Luther King celebration at De Anza College. Join in tomorrow. And then starting on the 21st of this month, which is a Friday, from 10 a.m. to 2 p.m., we're going to start vaccinations again. So if you need a booster, this is your time to come and get a booster. So we're starting back here at Truvine on the 21st. We'll be here every other Friday. We are partnering with Umoja Health, to come and bring vaccines to the people, by the people, for the people. All right, so mark your calendars. We will have the link next week for you to register to come get your booster shot. All right, I think that is it. Thank you once again for watching and tuning in to Talking with Dr. Donna. It's so great that you keep your appointment every single Thursday with the doctor. So thank you for being here. Again, if you have not subscribed to my channel and you found anything, something, one little nugget today that you liked, go to my channel, subscribe, and then share tonight's episode. I'm praying for you parents out there, you educators, teachers, administrators. This is a tough time, but I thank you for doing your work and for loving our children. Until next week, take care. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.